Hello, and welcome to today's webinar on Access to Genetic Counselor Services Act of 2019, or HR 3235. Your audio is muted when you join the call. Questions during the webinar can be submitted via the question box or the chat box on your screen. The webinar will last approximately 15 minutes, probably a little bit under that, including time for a Q&A session after the presentation when you will be able to unmute your audio. The webinar is being recorded and will be available on the PWSA USA YouTube channel. Effective advocacy is essential to ensuring the health, safety, and enhanced quality of life for those affected by Prader-Willi syndrome. As such, PWSA USA is committed to informing the PWS community of critical public policy issues to leverage the power of grassroots supporters to enact change. Because Prader-Willi syndrome is considered a rare disease, extra effort is needed to raise awareness amongst our public and elected officials to guarantee the passage of legislation and regulations that help our community and defeat those that do not. I'm going to go through the next few slides quickly, but don't feel like you need to take notes. After the webinar, you will be provided with a copy of this presentation, some key talking points, and a recording of the webinar. First, we'll cover a little bit about how the Centers for Medicaid and Medicare Services work, what genetic counselors do, some key bill provisions, and how this impacts the PWS community, and what you can do to advocate for the passage of this legislation. So let's get started. Before we talk about the bill itself, let's talk a little bit about the background of the Access to Genetic Counselor Services Act of 2019. The bipartisan bill was introduced to the U.S. House of Representatives on June 12, 2019 by U.S. Representative Dave Losbach and U.S. Representative Mike Kelly, and developed by working closely with the National Society of Genetic Counselors. The U.S. Center for Medicaid and Medicare Services currently provide coverage of medical services for 60 million U.S. beneficiaries. CMS covers the cost of genetic testing and allows healthcare providers to bill for genetic counseling services. However, because CMS does not recognize genetic counselors as healthcare providers, genetic counselors cannot see patients independently and be reimbursed for their services. This gap in reimbursement coverage creates a barrier to care by decreasing access to appropriately trained healthcare professionals, increasing costs to the Center for Medicaid and Medicare Services, causing longer wait times for appointments and medical errors due to incorrect interpretation of genetic information by non-genetics trained providers. HR 3235 will allow Medicaid and Medicare beneficiaries to be seen by genetic counselors, ensuring that they receive the benefits of the rapidly advancing field of medical genetics in a timely, cost-effective, and professional manner. So what do genetic counselors do? Genetic counselors are healthcare providers who have master's degrees in medical genetics and counseling and are board certified and licensed in over 30 states. Board certification, state licensure, and continuing education provide assurances to the public, employers, and insurers that all practicing genetic counselors have the knowledge, skills, and expertise needed to meet the needs of patients and their medical colleagues. There are over 5,000 genetic counselors in the United States currently, and that number is expected to double in the next 10 years. In contrast, there are currently about 1,500 medical geneticists. Some are MDs and some are PhDs, and not all of them see patients. And less than 100 new geneticists are certified every 2 years. So what's in this bill that makes it so special? Most importantly, this bill will allow genetic counselors who are board certified healthcare providers to be recognized by the Centers for Medicaid and Medicare Services. This recognition will result in increased access to genetic counseling services for up to 60 million Medicare beneficiaries. It'll also provide a cost savings as increased appropriateness of genetic tests will be saved, and it'll save up to $4 billion to the Center for Medicaid and Medicare Services over the next 10 years. Additionally, independent billing by genetic counselors at 85% the rate of medical doctors is projected to save Medicare about $50 to $135 million over the next 10 years. It will also decrease wait times as genetic counselors are able to see appropriate patients independently. Current appointment wait times in specific specialties will also decrease. It'll also decrease fraud. Genetic counselors are well equipped to recognize fraudulent activity as they know the guidelines and have the detective skills to investigate Medicare fraud. You're probably wondering what this has to do with the PWS community. And PWS, as we know, is a genetic disorder. It's diagnosed using a series of specialized genetic tests. Common chromosome tests, such as the karyotype, do not reliably detect genetic changes of PWS. Genetic testing for PWS can be expensive and may require sending blood and saliva samples to specialized laboratories. DNA methylation testing is the best initial test for determining PWS. This test detects about 99% of PWS cases. It may also be referred to as the Prader-Willi and Engelmann DNA methylation panel. All 3 genetic subtypes of PWS will have positive DNA methylation analysis for PWS. The FISH test can be used to determine if the subtype of PWS is deletion. However, it will not detect the other 2 subtypes of PWS. Therefore, it should not be used as the first genetic test. Chromosome microarray testing can be used to detect chromosome deletions and many cases of uniparental disomy, or UPD. While medical geneticists and genetic counselors often work in tandem, recognizing genetic counselors as healthcare providers will allow genetic counselors to independently see those patients that are within their scope of practice and increase patient access to timely, appropriate care. Additionally, access to genetic counselors has been shown to decrease errors in genetic testing and information provided to patients and increase patient satisfaction. Over 10 new genetic tests are introduced every day. Both healthcare and medical providers and consumers are faced with a dizzying array of genetic testing choices. The advanced training of genetic counselors enables them to decide on the appropriate tests, interpret genetic test results, and guide them and support patients in seeking more information. So now that you know all about genetic counselors and the Access to Genetic Counselor Service Act of 2019, or HR 3235, let's talk about how you can advocate for its passage on behalf of the PWS community. First, you can send a physical email or a physical letter or an email. Your email or letter will be more effective if you address a single topic or issue rather than a variety of issues you may feel passionate about. A typed one-page letter is best. A physical letter is more likely to be read than an email. You can typically find an email or feedback web form and the mailing address of your elected official on their website. Sending an email to an actual person is far better than using a website form. If you have trouble finding the best email or physical address for your representative, call me at the office and ask. I'll be happy to help you out. Make sure your letter is legible and try to make it stand out by including pictures or bright colors to make sure it gets attention and leaves an impact. This isn't true if you're sending an email, however. Don't include attachments in your email because it may get caught in the spam filter and the staffer who's trying to read it won't be able to open your email. In both cases, keep it brief, polite, and free of grammatical errors. You can also use social media for advocacy. It's a very public way to show your support or opposition to the policies or actions of your representative. Not every elected official uses social media, but the ones that do are easily found by visiting their official websites. When posting, make sure that you tag their official page. Include a picture, as this increases the likelihood that others will read the text that goes along with it. Make it clear that you are a constituent of the elected official, and make the post personal. Be aware that any personal information that you share will be visible to the public on social media. You can also make a call to your representatives. It takes less than 5 minutes and is one of the most effective ways to advocate. Staff are dedicated to answering your phone calls, and every call matters. Phone calls require minimal time and absolutely no traveling. Every elected official will have a public telephone number that constituents can call to leave feedback. This could either be a place where you leave a voicemail or talk with a staff member. Only call your own elected officials and clearly state the address at which you are registered to vote so they know that you are a constituent. Clearly tell the staffer what you want the elected official to do, why it is important, and why you feel motivated to call. Stay polite with the staffer on the phone, but be firm in your interaction as it will be short. You can also attend a town hall meeting. Attending a town hall meeting is a chance to meet with your representative and get updates on what they've been doing. They are usually held in a public setting and are free to attend. Lately, a lot of town halls have been taking place virtually. Town halls provide fantastic opportunities to gain face-to-face access to your elected officials. To find out when town hall meetings will be held, monitor your elected officials' website and social media pages. You can sign up for their email alerts, or you can even call their office to get event updates. In a typical town hall meeting, your elected official will speak for about 15 to 30 minutes about their activities in Washington. Then they will open the floor to questions from constituents. Raise your hand immediately when they ask for questions. The longer you wait, the more competition you will have for the microphone. This is your opportunity to ask about the Genetic Service Counselors Act. Make sure that you have what you're going to say prepared in advance. You may only be given less than a minute to pose your question. Prepare a short summary of the bill or issue that you are advocating for. Be sure to introduce yourself, state the bill number, title, and summary, what position you are advocating for, and what you want them to do. Your summary and explainer should be no longer than 1 page. Only address one bill or issue at a time. If you aren't given the chance to ask your question during a town hall meeting, stick around afterwards and find a staff member. They can take your comments, answer questions, and refer you to appropriate staff members as needed. Bring a business card or a printed letter about your issue to help them follow up with you. And don't forget to network with other people while you're there. It's a great way to get other people involved in the PWS community. Finally, you can schedule a meeting. Visiting your local district office takes some planning, but it makes the most impact. You'll have a chance to sit down with a staff member from your local district office, or maybe even talk directly to your elected official. In order to schedule a meeting, visit the website of the person you want to visit. You should be able to find contact information for their scheduler or chief of staff, or you'll find a section of their website called Request a Meeting. If there is a web form to request a meeting, just fill it out and someone will get back to you. Most state elected officials have district offices that are near your home address. You can ask to meet the elected official or a member of their staff in your district office, so there's less travel involved. You can also work with your local PWSA chapter to advocate as a group. The more people present at the meeting, the more amplified your message will be. Often, when a large group is requesting a meeting, the elected official will meet at a local library or a town hall or another local venue to accommodate the size of your group. You can expect to spend 10 to 15 minutes with the elected official. It is not uncommon for elected officials to have legislative assistants hold the meeting instead. While the elected official may only have a very limited amount of time during a meeting, their staff and representatives for them, their legal assistants, are in a better position to dedicate more time to hear your position and address your questions and concerns. When meeting with a representative or their assistants, introduce yourself and make a short statement about your position, your ask, your personal story, and why you came to meet with them. Be clear with what you are asking the person you are meeting with to do. Stick to the issue you asked to discuss. If the conversation goes off topic, just bring it back to the reason why you came, and don't be afraid to press the staffer or your elected official for a definitive answer or position statement in support of this act. Ask if the elected official will pose for a photo with your group, and if all members have given permission to be photographed, share it all over social media and thank them for supporting the PWS community. PWSA USA also has templates that you can use to help you personalize your emails and tweets and phone calls and letters. These templates act as a guide to help make the point that you need to make, but using your own words to make it more personal. That's everything. Thanks for attending. If you have any questions, feel free to submit them via the question box on your screen. While you're typing out questions, you can also unmute yourself to ask a question out loud. I want to remind everyone that PWSA USA is a 501c3 organization, so when you're meeting with representatives on behalf of PWSA USA, keep in mind that you're not lobbying, you're educating your legislators about the issues that are important to you. This is so we don't jeopardize our tax-exempt status. I also want to take a moment to encourage everyone to register to vote, check your voter registration status, and turn up at the polls this November. When we talk to our elected officials, we want to be able to say that 100% of the PWS community votes. If you need help finding out about voter registration deadlines in your state, voting times and locations, whether or not you're even eligible to register to vote, give me a call and I'll help you through the process. With that, I'll now take questions.
Andrea, this is Anne. What is the current status of this bill? Where is it in Congress?
Sure, it's currently in the House. It has been sent to a committee. Let me pull up a great site that I use to help track bills. It's pretty simple. It's actually just congress.gov. And let me search for this bill. It is the Access to Genetic Counselor Services Act. So I will share my screen in just a second so you can kind of see exactly what's been going on with it.
I actually did not know before right now that genetic counselors weren't included.
Yeah, they're a little bit different than medical geneticists who have like an MD or a PhD. Genetic
Right.
counselors are usually at a master's degree level, and unfortunately they're not covered under Medicaid and Medicare, which a lot of patients with PWS use. So if you go to congress.gov and then you just type in the bill that you want to search for, you can see it right here.
Mm-hmm.
And then from here, you can see exactly what's been going on with this bill. So here we can see the text of the bill. It's long, they're usually a couple pages. You can see the actions that have been taken on this bill. So right now it's been introduced to the House, which happened last June. There are currently, this is another big one, are the number of co-sponsors and sponsors on a bill. We want a lot of co-sponsors for this bill. The more co-sponsors, the more likely it is to get passed. So when you talk to your representative, one of the asks that you can make is, hey, I really want you to co-sponsor this bill. Or if you're talking to your representative in Senate, if you're talking to your senator, ask them to create a companion bill in the Senate. Right now, it's only introduced in the House of Representatives.
Mm-hmm.
It has been, from what I remember, it has been referred to the House Energy and Commerce Subcommittee on Health, but it's just kind of sitting there right now. They're waiting to talk about it. Unfortunately, there are other bigger bills that they've been talking about lately, so this one's kind of taken a back seat. But we do need to, as constituents, it's our job to remind our elected officials that there are other things that we need them to focus on as well, including things like this.
Yeah. Okay. Thank you.
You're very welcome. Any other questions?
Hello. This is Barb Christensen. My question is, I live in a rural community. Can we do this by telehealth, the counseling?
It just depends on the genetic counselor that you are hoping to talk to, but a lot of them are offering telehealth right now because of the coronavirus pandemic. You would just have to reach out to the specific genetic counselor that you would want to meet with and see if they offer it.
Okay, thank you.
You're welcome. It doesn't look like we have any more questions, so I won't keep you any longer. We wanted to keep these brief and short to make them simple and easy to follow along with. If you do have any other questions, feel free to email us at info@pwsausa.org. Thanks everybody for coming.